administration proposed changes to Medicare. What you need to know. Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. Welcome. Today's video, we're going to answer that question, and I need to have a disclaimer on the front end. This is not a political video. This is not about politics at all. In the United States, as we all know, every 4 years we have an election, and it can be a new president unless it's a 2 terms. It could be for 8 years. But over time, new administrations come in, they make changes. So I'm here to talk about what the Trump administration is proposing and how that affects you, the Medicare recipient, and specifically 3 areas we're going to look at. One is Medicare Advantage plan. There are some proposed changes for these plans, and how is that going to affect you? Number 2 is prescription drug pricing. This is on everybody's forefront on their mind. Prescription drugs are extremely expensive, and even though there's been some changes in the Part D and the Medicare drug coverage specifically, it's outrageously expensive. So people are concerned about that. And last but not least, we're going to talk about specifically weight loss drugs and what this administration has decided in terms of that, what is covered, what is not covered. So first, number 1 thing, Medicare Advantage. Now, let's talk about what is Medicare Advantage. Medicare Advantage is Medicare Part C. And A and B is your original Medicare. You get that through the Social Security office. Medicare Advantage is provided by private insurance companies. When you are on Medicare, you do one of 2 things. You either do original Medicare with Part D, a drug card, or you do Medicare Advantage C. Both D and C are provided by private insurance companies. So Aetna, Blue Cross, Humana, United Healthcare, they get money from the government, and the Medicare Advantage plans must provide the same benefits as original Medicare A and B. They can, and most of them do, provide drug coverage, Part D. There are a handful of plans that don't. And last but not least, they can add perks that original Medicare doesn't cover, such as dental and vision and hearing and over-the-counter benefits and all these other things. There are currently 67 million Americans enrolled in Medicare. 90% of them are 65 or over, 10% are under 65, but right now, as of 2024, 51% of Medicare recipients are choosing Medicare Advantage. That means 49% take original Medicare and Part D drug cards. So Medicare Advantage is provided by private insurance companies, but they get money from the government. So the first thing this administration did was to increase payments to the insurance companies that provide Medicare Advantage plans. So that Trump just finalized this. They're giving 5.1% increase for Medicare Advantage starting in 2026. How does that compare? Biden had proposed 2.2% increase. And to put in perspective, this is the largest percent increase in a decade. It's expected to give $25 billion in payments. Now, why is this important? Well, last year we saw cuts to Medicare Advantage programs, and that resulted to cuts in benefit, increased out-of-pocket, reductions of some of the perks. A lot of the carriers kind of slimmed down their benefits. People were not happy, and that was partly due because of the reimbursements. They were getting less money and they couldn't provide that. So fingers crossed, we won't see cuts in benefits. We'll see an increase in benefits and better benefits next year. So that's the first thing. The second thing with regards to Medicare Advantage plans is coding. Okay, so coding practices, and this change is affecting the insurance companies that provide the Medicare Advantage and get money from the government. And so bottom line is they're changing the way they code so that they're trying to prevent an insurance company inflating the sickness of a person so that they get more money. That's what they're trying to prevent. So this is a good thing, right, for people, so they're not taking advantage of the system. And I will tell you, insurance companies are not happy about these changes, right? Because it's changing how they get reimbursed. And the last thing they are changing is kind of the oversight when it comes to marketing to consumers. And I don't have a lot of details on this, but it was getting pretty crazy. Part of the reasons is there's a lot of call centers that were making outbound calls. There's a lot of complaints to Congress. There were some crazy commercials a couple years ago. We've seen some of that change. But as far as an independent agent like myself, they just kept layering and layering and layering on all kinds of crazy things that we had to do before we could talk to somebody. You know, you can't talk to somebody for 48 hours. They have to sign a form that even if it's an inbound call, that you have an authorization to talk to them in writing and keep these. So there was a lot of stuff that was preventing us from helping people. So I don't know exactly what that is, but they're going to be kind of reducing some of that oversight a little bit. So I think that'll be good. So that's Medicare Advantage. Number 2 change that the Trump is making reflects around prescription drug pricing, okay? And the Trump administration has not been ashamed to say this. They are all about lowering the cost of drugs. And they take a very strong stance about lowering prescription drug prices specifically, claiming, and probably true, I'm sure it is true, that Americans pay significantly more money for the same drug that other companies pay a fraction of the cost. And I've heard all kinds of stories about this. We won't go into them, but some of the things they're doing is an executive order. Trump has done some executive orders, and one of them was to expand the Medicare negotiating of prescription drug prices. So it was part of the Inflation Reduction Act. They put in there that the government, the administration, can negotiate certain drugs, right? And it's about a dozen a year. It's a small number, right? And so Trump administration wants to expand on that. So that's a good thing. The second thing is he'd like to standardize the reimbursement for some very expensive drugs. Some of them might not fall under Part D. They might actually be under Part B or outpatient services, such as cancer drugs. And it doesn't matter where you get the treatment, because right now there's a discrepancy. Are you going to Mayo Clinic? Are you going to Cleveland Clinic? Are you in the middle of USA, Nebraska, and you go to your local hospital, or Wisconsin, or the East Coast or the West Coast? The reimbursement should be the drug is the drug, right? So he's trying to standardize that. It doesn't matter where you go for the service. It shouldn't cost more because you're at this facility. Okay, and so that's some things he's trying to do with prescription drug pricing. Number 3, specifically with regards to weight loss drugs, what is this administration's stance? Well, the Trump administration basically decided against a proposal to allow both Medicare and Medicaid to cover these drugs. Now, I know this is very controversial because a lot of people are saying, why can't we get this covered? I don't understand. I've been in the business long enough to remember a time that major medical didn't cover the stomach stapling or reduction, or any of the weight loss surgeries, let alone the drugs. But let's take a look at the numbers, because this is really where it lies. And, I think one of the things this administration is doing is looking at the numbers. Is this financially feasible? And it doesn't take a rocket scientist to figure out this is very expensive. 2023, according to the CDC, what is the CDC? It's the Center for Disease Control, right? It's a government agency. They said that 40% of Americans are obese. That's a bunch. That's 100 million people, okay? And if you take a look at the cost of a weight loss drug, and I'm not talking about Ozempic, which was developed specifically for diabetes, and then people started taking it for weight loss. The same manufacturer of this drug that discovered Ozempic later developed Wegovy. They're out of Denmark. It's a company, and I forgot the name of it, but 60 Minutes did a special on them. They developed, after they figured out that, oh, by the way, Ozempic, the side effect is, hey, you lose a lot of weight, they developed Wegovy. And Wegovy is specifically for weight loss. It is not tied to treating diabetes or high blood pressure or heart disease. The average cost and you can look on a lot of different sources, but the retail cost is $1,350 a month. And most people that take this, they have to be on it for the rest of their lives, because once they come off it, they haven't treated the cause, which is, why are you overeating? They're treating the symptoms. You're overweight, you're obese. And so this reduces that. Once they come off it, there's no guarantee that they wouldn't gain all that weight back. So if we do simple math, I'm just going to round down, $1,300 times 12 is $15,600 a year to treat one person times 100 million people, 40% of the population. That is $1.56 trillion. Now, currently, we spend $4.9 trillion overall in the United States on all healthcare. Medicare, Medicaid, group health insurance, that's how much we spend. This one drug would increase the overall spend 30%. So one of the reasons I think the administration, and I don't know this for a fact, is saying, hey, this is not affordable. And I realize a lot of people want that quick fix, right? It's easy to take a pill. It's a lot harder to join a gym, to hire a coach, to take a nutrition class. That's more work. But ask yourself the following question: are there other ways to lose weight that cost less money? That's the first thing, right? And second thing is, should medical insurance cover weight loss? I'm not here to answer that. Traditional medical insurance was if you were hospitalized, if you needed surgery, it wasn't for weight loss or stop smoking or some other things. But maybe instead of paying for a weight loss drug that costs $1,300 a month, that would increase the overall spend over $1 trillion and 30% overall healthcare, maybe they should pay for other things that help you, because we all know if you're overweight, that leads to other health problems, right? Nobody's going to deny that. But the question becomes, what should they pay for? I don't have the answer, but I'm just here to tell you what the Trump administration has decided and how it affects people, because we get this question asked all the time. So in summary, the Trump administration is increasing payments to Medicare Advantage plans. That's a good thing. They're changing some of the way they code things to prevent them from making people look sicker than they are, so they get bigger reimbursements. On the prescription drug coverage, whether you're on C or D, doesn't matter. They're trying to negotiate more drugs, a lower cost for the drugs. And last but not least, they're banning coverage by Medicare and Medicaid for specific weight loss drugs. We hope you found this helpful. Please tell your family and friends about our channel. Give us a thumbs up, and don't forget to leave a comment. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance. Thank you for watching.